Ectopic pregnancy, what you need to know. What is ectopic pregnancy? An ectopic pregnancy occurs when a fertilized egg implants and grows outside the uterus, typically in one of the fallopian tubes. In a normal pregnancy, the fertilized egg implants itself in the lining of the uterus where it can grow and develop into a fetus. However, in an ectopic pregnancy, the fertilized egg implants elsewhere, often in the fallopian tubes, but it can also occur in other locations such as the ovaries, abdomen, or cervix. Unfortunately, the fallopian tubes are not designed to support the growth of a developing embryo, and as the embryo grows, it can cause the fallopian tube to rupture, leading to severe internal bleeding and potentially life-threatening complications for the pregnant person. Ectopic pregnancies are not viable and cannot develop into a healthy baby. They must be treated promptly to prevent serious complications. Treatment options for ectopic pregnancies include medication to stop the growth of the embryo or surgery to remove the embryo and repair any damage to the fallopian tube or surrounding tissue. Early detection and treatment are crucial for the health and safety of the pregnant person. Symptoms of an ectopic pregnancy. Symptoms of an ectopic pregnancy can vary, but some common signs and symptoms include 1. Abdominal or pelvic pain. This pain may range from mild to severe and may be localized on one side of the abdomen or pelvis. It may come and go or be persistent. 2. Vaginal bleeding. Light bleeding or spotting may occur, often lighter or different in color compared to a normal menstrual period. 3. Shoulder pain. This occurs when blood from a ruptured fallopian tube irritates the diaphragm, which shares nerve endings with the shoulder. 4. Nausea and vomiting. Some individuals may experience symptoms similar to morning sickness. 5. Weakness, dizziness, or fainting. These symptoms can occur due to internal bleeding resulting from a ruptured fallopian tube. 6. Rectal pressure. Pressure in the rectum can occur if blood leaks from a ruptured ectopic pregnancy into the pelvic cavity. It's important to note that ectopic pregnancy symptoms can mimic those of other conditions, such as miscarriage, ovarian cysts, or gastrointestinal issues. If a person experiences any symptoms suggestive of an ectopic pregnancy, they should seek medical attention promptly. Early diagnosis and treatment are crucial for preventing complications. Causes of ectopic pregnancy. The exact cause of ectopic pregnancy isn't always clear, but several factors may increase the risk. These factors include 1. Damage or abnormalities in the fallopian tubes. This could result from previous pelvic inflammatory disease, PID, endometriosis, pelvic surgery, or tubal surgery. Any condition that affects the shape or function of the fallopian tubes can increase the risk of ectopic pregnancy by interfering with the movement of the fertilized egg to the uterus. 2. Previous ectopic pregnancy. Having had an ectopic pregnancy in the past increases the risk of experiencing another one in the future. 3. Inflammation or infection. Infections of the reproductive organs, such as sexually transmitted infections, STIs, like chlamydia or gonorrhea, can cause inflammation and scarring of the fallopian tubes, increasing the risk of ectopic pregnancy. 4. Hormonal factors. Hormonal imbalances or conditions such as endometriosis can affect the functioning of the fallopian tubes, increasing the risk of ectopic pregnancy. 5. Certain contraceptive methods. While rare, ectopic pregnancies can occur in individuals using intrauterine devices, IUDs, for contraception. Additionally, tubal ligation, surgical sterilization, doesn't guarantee 100% protection against ectopic pregnancy. 6. Smoking. Tobacco use has been linked to an increased risk of ectopic pregnancy. 7. Assisted reproductive technology, ART. Procedures such as in vitro fertilization, IVF, can increase the risk of ectopic pregnancy, particularly if there is underlying tubal disease. It's important to note that in many cases, ectopic pregnancy occurs without any identifiable risk factors. Additionally, having one or more risk factors doesn't necessarily mean an individual will experience an ectopic pregnancy. However, being aware of these risk factors can help individuals and healthcare providers take appropriate precautions and promptly address any concerns. Diagnosis of an ectopic pregnancy. Diagnosing an ectopic pregnancy typically involves a combination of medical history, physical examination, and various diagnostic tests. Here's an overview of the diagnostic process. 1. Medical history and physical examination. The healthcare provider will ask about symptoms such as abdominal pain, vaginal bleeding, and any risk factors for ectopic pregnancy. They will also conduct a physical examination, which may include a pelvic exam to check for tenderness, mass, or abnormal findings. 2. Blood tests. Blood tests are often performed to measure the levels of human chorionic gonadotropin, HCG, a hormone produced during pregnancy. In a normal pregnancy, HCG levels typically rise rapidly in the early stages. However, lower than expected or plateauing HCG levels may indicate an ectopic pregnancy or other pregnancy-related complications. 3. Ultrasound. Transvaginal ultrasound is a common imaging test used to visualize the reproductive organs and confirm the location of the pregnancy. During this procedure, a probe is inserted into the vagina to obtain high-resolution images of the uterus, fallopian tubes, and ovaries. In an ectopic pregnancy, the ultrasound may reveal an empty uterus and a gestational sac or mass located outside the uterus, often in one of the fallopian tubes. 4. Diagnostic laparoscopy. In cases where the diagnosis is uncertain or if there is suspicion of a ruptured ectopic pregnancy, a diagnostic laparoscopy may be performed. This minimally invasive surgical procedure involves inserting a thin, lighted tube with a camera, laparoscope, through a small incision in the abdomen to directly visualize the reproductive organs. Laparoscopy allows for the identification and treatment of ectopic pregnancy while minimizing surgical trauma. 5. Other tests. In some cases, additional tests such as pelvic MRI, magnetic resonance imaging, or serial HCG monitoring may be recommended to aid in the diagnosis of ectopic pregnancy or assess the response to treatment. Prompt diagnosis of ectopic pregnancy is crucial for preventing complications such as rupture and severe bleeding. If ectopic pregnancy is suspected, healthcare providers will typically initiate appropriate management, which may include medical treatment with methotrexate to stop the growth of the ectopic pregnancy or surgical intervention to remove the ectopic pregnancy and repair any damage to the fallopian tube.